I hope everyone's having a great Monday. Hi, Amanda.
Hello,
Good.
how are you?
So we're going to talk about body contouring today,
Yes.
and all the things that we can do with body contouring and what that means. Sort of like a body contouring overview.
Yeah, and I think it's kind of fun. We've decided that's going to be our focus for this month, right?
Yeah, you bet.
Because we know beach bodies are made
Yes,
in the
they
winter.
absolutely are. And if you're anything like me, I had all good intentions in the new year and made all kinds of, resolutions, or I'm going to change this, but I'm kind of losing motivation right now. You
I
know?
don't know that I ever actually had it, to be totally honest, but I should have it. But this just seems like, I don't know.
It's been an unusual year all around, but sometimes for myself, when I'm losing a little motivation, I need a little help, right? If I see some results, I've made all these changes. I'm drinking more water, but now I want to see a result, right? To keep that motivation going. That's kind of
Totally.
where I'm at, and I think a lot of people are at that space right now.
Yeah, I think, there's kind of two types of people, right? Like there's those people that I admire that are like, when I get to this goal, I will give myself this reward. And it's kind of like that whole the road less traveled,
Right?
right? And then there's like my camp, which is like, okay, no, I need to see, I need the carrot now so I can get excited, right? And I think that's where body contouring is so great.
Yeah, it is fantastic. And when
So,
we talk about body contouring, what we're really talking about is changing shape and removing areas of stubborn, sort of even genetically predisposed areas of fat that people will have, whether it be under the chin or the bra pocket area or the back, or tummies are a big one, especially as
mhm,
we get a little older,
mm,
that tend to be more challenging. Our metabolic profile changes, right? And our ability to burn fat in certain areas changes. So, we're talking about removing those things and shaping the body, right?
yeah. And I think when you talk about, getting older too, I mean, clearly this is for anybody that, adult that wants to do these sort of treatments. But I remember having conversations with my grandmother as a child, and we were talking, and she just was talking about changes in her body that happened. And I'm like, well, what do you mean? Like, because she always looked the same to me. I didn't know. And I'm like, well, what do you mean it changes? And I'm like, do you get bigger or like smaller? She's like, well, it kind of moves,
Kind of move.
right? Yeah, and I think like you always talk about, that Achilles heel, right? So if people typically hold their weight under their chin as they get older, that can be even more of a concern.
That's right. Or
But then again, you can have somebody that's always had a fairly flat stomach and now all of a sudden they're like, "Ooh, what is this?"
what is going
You
on
know?
here? Yeah, that
Yeah.
happens to a lot of people. And not everybody wants to look at surgical options for that, right? So when we think about removing fat permanently and
Hmm.
improving on a permanent basis, so often we think, well, the only option for me then has to be a surgical one. But that's so
Right.
not true. There's so
Hmm.
many options there now, and especially cool sculpting is huge. It's been around for over a decade.
Yeah.
What is 8 million treatments done worldwide?
Yes.
Fabulous sort of safety profile, right? And it works.
It
It
totally works.
totally
This is like, I was looking at these. I'm sort of looks like R2D2, and if this guy was gold, it could be my C3PO, but
works.
it didn't totally work. But um,
Yeah, true.
I'm pretty fond of this one over here. I'm not gonna lie, because man, it is a pretty awesome treatment. And I guess maybe it would be helpful to explain to people sort of what is body sculpting. Is it weight loss? Who can come and have these treatments, right? Because I think
Yeah.
I always sort of liken it to, if you had a, it's not a very nice analogy, but if you had a potato and it kind of had a lump on one side that you didn't like, you could take that carrot peeler and you could kind of shave that lump down, right?
Yeah,
So it isn't necessarily an overall let's make everything smaller. It's more, how do we go in and and carve out those areas that we just can't seem to
Yeah.
budge.
Body sculpting is a lot like aesthetics in general, right? So we do body sculpting in our clinic. First of all, we want to hear your goals. So we want to hear what you want to see in the mirror, but we also want to keep in mind what looks good from an aesthetics perspective. And it's really interesting, I love to read studies. I'm such a geek that way. I love science and I love data and I love looking at all the research on all these things, but also about general aesthetics, right? So when you look at studies that have been done on what people find attractive, when you look at models, whether they be really slim or whether they be plus size models, there's a ratio that's always similar amongst them. And for women, it has to do with the size of the waist versus the hips and that sort of really lovely hourglass shape. So,
thankfully we don't wear corsets anymore.
That's right. We don't. I mean, you can go.
Could you imagine?
Yeah.
Or like remove a rib.
Right. To get that
out. No thanks.
No thanks.
No, we don't need to do that.
We don't need to do that, right? So what we're trying to do with cool sculpting is remove fat deposits in certain areas on a permanent basis to create that hourglass. Because we all know that it's unlikely that we're going to stay the same size from when we're 30 to when we're 50, 55 plus. Things might change. We might lose weight, we might gain weight, but what's going to always look good is if we create that lovely shape, that nice, womanly shape for women. And when they look at men, the thing that is generally most attractive is that sort of the Superman shape, right? So you can help a person achieve that wonderful shape. So when they wear their dress shirts, it just looks nice. When they put their dress suit on, their business attire on, it just looks nice. And the same for women. So that's what we're trying to achieve with our body sculpting, treatment. So cool sculpting is amazing.
And then, of course, it isn't just cool sculpting anymore, right? I mean, cool sculpting's been around for years. We've done, hundreds and hundreds of treatments here. But now we can kind of step up the game and address some other concerns because maybe you've had kids, maybe you've lost weight, but, there are changes inherently that happen to the skin, right?
Absolutely.
And up until now, that's been a really challenging thing for us to address. Whether it could even be loose skin on the knees. I don't know how many girlfriends I know that have slimmer legs. I've always been very jealous, but now they're like, I'm in downward dog and I'm looking at my skin and it's like, it's like hanging there, right?
I know.
So it isn't just about bulk.
Yeah. So that's the beauty of how we approach this. So cool sculpting can decrease bulk and create that shape. And so when you're wearing clothes and everything, it looks nice. But sometimes we're bothered by areas of laxity, right? And that's a concern that people have shared with us too. If I do cool sculpting, what happens if I get a little bit of laxity? Well, if you're in our clinic, we can help you with that too. So we have that beautiful InMode machine that's behind you with radio frequency that we can use to treat skin laxity at the same time as we debulk areas. That Morpheus body, loving it.
We love this. It's amazing. So this is just like a cover that's on here right now. But when you come for a treatment, what happens is we put on it's a disposable piece. So that's not something we clean or reuse. It gets tossed into the sharps bin. But on the end here, there will be the little piece with the needles, right? And we numb you up really well. And then these needles go into the skin and you're numb. And then what happens is that pulse of radio frequency is delivered deep, right? And that heat is what causes that tightening of the skin.
That's right. Because as we age, our collagen, if you imagine it, I love the analogy of a slinky. It's like a slinky. And
that's a good one.
It stretches out. And if you imagine overstretching a slinky, you try to roll it down the stairs and it just won't do its thing. It's lost that elasticity. What radio frequency does, if it's delivered at the right depth, it will actually sort of reconfigure that slinky, bring that elasticity back, create that tightness, so that now that elasticity is back, along with making your body create more collagen. So it's a beautifully scientifically elegant treatment that way. And with that radio frequency too, if we deliver it deep and sort of stack it and pulse it continuously, we can actually melt areas of fat too. So that there in your hand is a 2-for-1. And so there's really no area that we can't treat now. Cool sculpting for some of the areas that it's approved for, as far as, you know, submental, bra fat, abdomen, and then, you know, use the Morpheus for the stretch marks, for tightening, and also for the smaller areas that maybe that applicator won't fit on, right? So we've got some really...
That's a really good point. I had a consult a couple of weeks back, and I had this lovely client, and she had lost, through, you know, good diet and exercise and healthy living, had lost a tremendous amount of weight. I think she was left with quite a large amount of excess skin, so to the point where it did have to be surgical, because there are different patients, right? But she was left with those little, do you call them what do you call those, dog ears?
Dog ears, right? With the
dog ears.
Yeah.
Right? So she had this lovely tight abdomen, everything was lifted, and she had her tummy tuck or whatever it was, because in her case, she just had so much excess skin. But she's really bothered by that, because down on her hips, she's got, you can see the incision, and then you can see this like little, I don't know how, like a little pocket of tissue around it.
Yeah. Right.
So something like this would work for that, would it not?
So you can just, and in fact, it'll help the scar improve as well, right? So we're just going to melt the fat, improve that dog ear appearance, create some tightening. So, you know, when you're looking at body contouring solutions, you want to address all those things, right? Debulk, create that shape, improve the tightness of the skin too. And we also have body effects. Let's not forget that.
Yes, I was just going to say, we got to talk about this one. We had that awesome before and after that we just had on our, I think it was up on Instagram. Maybe it was up on Facebook too.
Yeah.
And that was kind of a combination treatment, I think, because she had done, I believe, just 2 panels or cycles, I should say, of cool sculpting on her lower abdomen. And then everything that we were seeing on the upper, all of that reduction in bulk and the tightening of the skin was done from this guy.
That's right. Yeah. All
this is, love this. So this is, maybe you could explain how this one works. So cool sculpting, we understand, works by, is it cryolipolysis? Lipolysis?
Yeah.
It makes it really cold, and then they die.
That's right.
Right. So they freeze, right? So the fat cells freeze and they die because they freeze at a different level than the tissue around, and everything else is safe and comfy. This is
cold,
yeah, they don't like the cold. Now, this is a bit different. So this one here, if you can see, so this is the handpiece the technician uses. On the back, there's a gauge that will show what the temperature is. And then this end is the part that goes against the skin, and it's kind of like a little vacuum, isn't it?
It
in there.
You get a bit of suction, and those 2 metal plates that you're seeing there on the screen will send radio frequency from one to the other and create some heat within the tissues. And at certain intervals, it sends a pulse of electricity so that it actually creates little holes in the fat cells. It's called electroporation. And the fat just sort of oozes out. And again, that act of creating those little holes will trigger a cell death, much like cool sculpting in that regard. And both those technologies will decrease the amount of fat in the treated area by 28%. So you know,
there are kind of 2 ways to do it. So, you know, cool sculpting, I think it's helpful for people to understand. So you would come and have your treatment, and depending on the area, you're going to have a number of cycles or adapters that are going to be placed on the body. And I have a bunch of them behind me here, like this sort of thing, where, you know, we've got different attachments that we can put on based on the amount of bulk that's in there. And then once you've had that treatment, whether you're doing, you know, 1 of these or 4 of these, depending on the area, that's it. We don't see you again until maybe we want to retreat the area. Could be as soon as a month, could be a couple months, or maybe you're fine with one round. Whereas something like this, you're going to be super familiar. You're going to see our smiling faces every week, right? Because this is a kind of treatment where we need to repeat weekly.
That's right. Yeah.
Neither one of them, I would say, are uncomfortable. I think with the cool sculpting, the little massage at the end can be a bit weird, but it's 2 minutes. This one here, I think you feel more warmth.
Yeah, you feel
when you're having it.
And a little zap, and then warmth and a little zap. It's quite tolerable. It's It's not bad at all.
So often when people are kind of trying to determine which, modality that they should be using, I would say I typically look at how much bulk they have in the area, and can I get a cool sculpting adapter in that area? And often I would start them there, and then maybe use this, because this also has a bit of a tightening effect too.
Has a tightening effect, yeah. So if laxity is a main concern, then oftentimes we'll go with body effects first, especially if they don't mind coming in to see us on a regular basis like that. I mean, schedule always plays a part, right?
Right.
So that's the other thing. We can also accommodate your schedule. So if you're, if you're someone who's like one and done, we're going to lean towards cool sculpting, and we can always create some tightening with the Morpheus, which also gives tightening. You don't have to come in every week. But body effects is a proven treatment, and a lot of people prefer that because maybe they don't have stretch marks, right? Because the Morpheus 8 will also improve stretch marks and skin quality. Maybe they don't have stretch marks, but they really want to get as much reduction in bulk as you possibly can, because you get 20% reduction with body effects as well, and tightening at the same time, and they don't mind coming in to see us, right?
Yeah.
So, yeah.
But having said that, just to muddy the water and confuse it even more, and I think this is why consults are so important, right? So people will phone in and say, well, I want to treat my abdomen. How much is that going to be? Well, okay, well, what are we looking at? Because everybody's different, I'm super short-waisted. I might have a completely different set of, adapters for my torso as opposed to someone else.
Yeah, and everyone's different with respect to their goals, right? So for some people, they have that one dress that they want to wear, and every time they wear it, they see the bulge in the back, or that specific suit that would cut so nice and was perfect, 5 years ago, and now they can't wear it. And their goal really is around looking great in a particular item of clothing, or looking nice in clothes. And then you have some people who are like, I want to look great, in my bathing suit. I used to love wearing 2 pieces, and now I don't feel comfortable wearing that 2-piece. So their treatment plan is going to be completely different from that person who wants to look great, in their clothing. And then, you have other people who are like, I want to feel comfortable in my own skin in my birthday suit, when I look in the mirror, this is what I want to see. And again, then we're going to be looking at skin integrity, and we're going to use other modalities. And the beautiful thing is we can do that. We have the technology now, right?
Yeah. Yeah, that really is. It's nice to kind of have that full gamut. And again, with all of them being super effective, right? And I think that's, we talked about that the other day, just how everything that involves a piece of equipment is really, it's dependent on the operator, right?
You need to make sure that you're, you know what areas you can treat, and what the target is as far as treatment. So especially with the radio frequency modalities, you want to get this tissue to a certain temperature and keep it there for a certain length of time. And that's key. And if you don't, then you're not going to get the optimal treatment. So it is definitely operator dependent. You have to get the tissue to a certain temperature for a certain amount of time with radio frequency. Even with cool sculpting, your massage is key. right? So all
Totally.
these things are, and applicator placement. So it's all about how you use your tools, right?
Hmm.
I mean,
And
I
I
can,
think that's where we're really lucky because, like you said, you are a self-professed nerd. You have an inherent interest in every single machine that you bring in. And I love that about working with you because it's not like you're just like, okay, here, you know, here's the, you figure it out. Like you do all the research as well. You take all the courses and then you train our technicians.
yeah, yeah, we do. I take a great interest in that because at the end of the day, you're still my patient, right? So that's important. So yeah, no, I love doing that. And then we often will take machines, and because we know how they work, we might be using them very differently from, from
Yes, I
because
can speak to that.
yeah, so
Yeah, you know, that's the thing, right? You get the machines and they have that sort of standard in the box parameter
yeah.
that you get from the manufacturer, which is fabulous.
Hmm.
But I think once you have someone with your knowledge and experience, we know that to get an even better result, we can push you just a little bit further, right? Or push the machine a little bit further or adjust those settings, whether it's time or, you know, intensity or what have you.
Yeah, yeah. So it's great. So body contouring, we're going to get into it a bit more over the next couple sessions, right? We'll talk about the different technologies in depth, but body contouring these days is really an alternative to liposuction or some of the surgical procedures that are done. So, when you're looking at surgical tummy tuck, we can offer some alternatives. When you're looking at sort of reshaping, even submental liposuction, people don't do that anymore. We have other options, right?
Mm-hmm.
So that's what we're talking about with body contouring. Arms, bra fat, back fat, tummy tucks,
Thighs, saddlebags.
thighs, saddlebags. Yes, those don't really respond well to surgery. And we wanted to touch briefly on cellulite as well.
Mm-hmm.
That's the beauty of these machines as well, because you're creating some tightening, you're going to get improvement in cellulite. Now, all of us know, I think, that cellulite is basically something you can control and improve. Getting rid of it completely is a challenge. However, you can get some significant improvement with these technologies, because cellulite basically is you have fat, and in between the sort of layer of fat, you have these bands that come up to the skin, and you've got fat there like little grape globules, and they pouch out and they create this sort of textural change on top. So when you create tightening of the skin, you kind of push down that outpouching. When you decrease the volume of the fat underneath within that banding, you actually improve the contour too. So, using those modalities together will actually improve cellulite as well. So we've got stretch marks, fat contour improvement with reduction of fat, improvement with stretch marks. It's really like a 360 approach.
Yeah, and I think that's the cool thing because like you said, some people will come in and they'll be like, well, I've already got a little bit of loose skin. What's it going to look like after I debulk, right? And so we have tools we can help with that,
Right.
which is pretty
So,
exciting.
yeah, so we'll see you guys next week, same place, same time. Bring your
We'll be here.
questions. We'll be here. Okay. We'll see you next week, Amanda.
It's a
Okay.
date. Looking forward to it.
Looking forward to it.
Bye for now.
Bye.